Now, let's start talking about level 2 exercises. If you're in level 2, what should be happening now is your shoulder should be feeling a little bit better. Pendulum's doing its thing. There's not as much constant pain. Hopefully you're sleeping better at night. And you're definitely getting a little bit more active range of motion out of your arm. Now the goals for rehab in phase 2, we want to try to establish full range of motion of the shoulder in all different directions and start entry-level strengthening exercises. Remember, you can't start strengthening something if there's inflammation and if you don't have full range of motion. So there's 7 exercises. The first exercise is the pendulum, like we did in phase 1, but now we're using the pendulum more as a warm-up. So once again, I need the use of a chair. The right arm is my affected arm. I'm going to slowly lean over here. Like we talked about in phase 1, the idea is to feel a traction, feel a little bit of a stretch. You may want to use anywhere from 2 to 3 pounds now on your arm, 4 different directions. Remember, we're going counterclockwise, clockwise, up and down, and then back and forth. And the idea is 10 times each direction to improve the mobility of the shoulder and to loosen up the shoulder joint. The second exercise in phase 2 is also a review of an exercise in phase 1. Remember what we learned in phase 1. Engaging the lower abdominals to provide a stable base. Shoulder blades are back and down. Once again, elbows are bent, thumbs pointed out, and now we're really trying to normalize the external rotation on the affected arm. Remember what we're accomplishing with this exercise. We're stretching out a muscle deep behind the shoulder blade called the subscapularis. When that subscapularis is tight, that can lead to a lot of shoulder problems, so it's in our best interest to keep it stretched out. This one here, you'll notice I'm not holding it for very long, but I'm going to do about 15 repetitions with each one, trying to get a little bit more range of motion until it equalizes the other side. The next exercise in phase 2 is called a posterior capsule stretch. Let me show you something here. Posterior, or basically behind the shoulder. The rotator cuff has 3 muscles: the supraspinatus, the infraspinatus, and the teres minor. They all come through and they attach on the outside or the lateral part of this arm. The capsule of the shoulder joint simply refers to the connective tissue that's right around the back part of this capsule. The reason why it's important to stretch it is because tightness of the posterior capsule and the rotator cuff is a precursor to a lot of shoulder problems. So it would make sense that a good shoulder program consists of stretching out that area to hopefully prevent shoulder problems in the future. So this is what it's going to look like. Once again, my right arm is the affected arm. I'm going to support it with my left arm. My right arm is nice and limp. I'm going to bring it across my body until I start to get a little bit of a stretch. I might feel it in the arm. I might feel it back in through here. Now, it should not be painful. You're only going to go as far as you can comfortably. You may feel a little sensation up and through here, and that's okay, because what happens is the bicep tendon sometimes gets inflamed when you have a shoulder problem. Don't worry, it'll eventually go away. You're going to come over as far as you can comfortably. You're going to hold that stretch for 30 seconds and repeat that 2 or 3 times. What you may find is a slight elevation or lowering of your arm will facilitate a better stretch. So play with that angle until you feel like, there, now I'm getting a good stretch out of that area. And you're going to hold it for about a 30-second count. And then after 30 seconds, you're going to let your arm come on back down. And then repeat that again 2 to 3 times. The next exercise is an exercise that's going to help to improve shoulder flexion, which is basically the ability to move your arm straight up. Remember, if you're in phase 2, you've probably got about 70-80%, but we want to maximize that. We want to go for 100% range of motion. So what you're going to need is a door frame for this exercise. So what you want to do is, you want to stand in the middle of the door frame, comfortably rest the affected side right on the door jamb. With your thumb pointed up, slowly slide up as far as you can, and then back down to neutral. The idea here is, is to reach for the ceiling as far as you can. You may feel a little stretch underneath the arm. You may get a little pain up top, but that's okay, as long as it's manageable. The goal of this exercise is to regain full 100% flexion of the arm. And then back down to neutral again. And repeat that for a total of 15 times. Good. For the next exercise, we're going to need a cane, or in this example, a 4-foot PVC pipe. Remember, the first exercise, we regained shoulder flexion using the door jamb. Now what we want to try to do is improve abduction, which is the ability of your arm to go out to the side, but we're going to use this cane. So in this example, my right arm is the affected arm, thumbs up here. My left hand is my driver arm, and that's going to be palms down. Remember to engage the core, shoulder blades back and down. And I'm going to slowly use my left arm to come up as far as I can comfortably, and then back down again. And then I'm going to repeat that for a total of about 15 times. I'm not holding the top position for very long. And what you can do is vary the angle just a little bit in order to help you achieve as far as you can away from your body. The next exercise also requires the use of a cane, and this exercise is going to try to improve shoulder extension. Let me demonstrate. This is shoulder flexion, this is shoulder extension. Now, it's not a very big motion, but it's critical, because as we learn to bring our arm behind us again, it puts a little bit of a stretch in the bicep tendon and the front part of the capsule, which we don't want to get tight. So once again, the right arm is my affected arm. I'm going to stand up nice and tall. I'm going to use those principles we learned in phase 1. I'm going to engage the core. Shoulder blades are back and down. I'm comfortably grabbing the cane, palms facing back, about shoulder width apart. And then all I'm going to do is bring it back as far as I can comfortably, and then back to neutral. And once again, I'm not holding the position for very long, pausing maybe 1 to 2 seconds, but I am going to repeat it 15 times. What you may feel when you're doing this is a little pull in the front part of the capsule, and that's okay. That's what we want to try to do. The final exercise in phase 2 is an entry-level exercise to strengthen up the rotator cuff, and you're going to be back in the door frame for this exercise. What you'll do is you'll stand in the door frame. Once again, my right arm is the affected arm for this example. So I'm going to bend my elbow here, and what I'm going to do is gently push my arm into the wall until I feel a tightening of the muscle along the lateral or the outside part of the arm and back by the shoulder blade. I'm maintaining a good posture with the posterior pelvic tilt, engaging the core, shoulder blades are back and down, and I'm going to hold that position for a 10-second count. And then I'm going to release it. And I'm going to repeat that about 10 times. Now what I'm going to want to do is have a strong contraction, but not enough to cause pain. So you're going to go as hard as you can, feeling the muscle contract, but not creating a whole lot of pain. Hold it for 10 seconds, and then you're going to release it, and then you're going to repeat that a total of 10 times. And that's the end of phase 2 exercises. Now remember what our goals are for phase 2. We want to try to reestablish full shoulder range of motion in all planes and slowly start to reestablish rotator cuff strengthening exercises. So you'll stay in phase 2 until you feel like you've got full range of motion of your arm, and then let's progress on to phase 3.